welcome back to halftime of our high school game of the week. Now time for our medical minute. And joining me, Dr. Roland Mayer from the Center for Orthopedics. Roland, nice to see you again.
Good to be back, Mark.
Let's talk about tendinitis. It affects young, old, all over the body. Talk about that and maybe almost a breakthrough.
Well, there has been a lot of press about a new treatment for tendinitis. As you say, the tendinitis is going to occur all over the body. Some of the more common places are the rotator cuff. Tennis elbow is a tendinitis. You can get it in the patellar tendon in the knee, and in the Achilles tendon down in the ankle. And many times these tendons are difficult to get to heal. Their blood supply is poor, and your body doesn't mount a very effective healing response. So there is a new treatment that's being investigated to try to stimulate more healing in a tendinitis, and that's an injection of something called platelet-rich plasma. It's something that we heard a lot about before the last Super Bowl last year, because a few of the players got injections to treat their aches and pains that they had built up over the course of the season.
It's supposed to be pretty quick.
It does seem to have, in some cases at least, a fairly quick response. It stimulates a burst of healing that may help to strengthen the tendon, make it less painful, and allow athletes to return to sport quickly without surgery. It's still unclear exactly where it's best and how much tendon damage it can reverse. But it's a promising technology that may provide a new treatment for these sorts of troublesome injuries.
Now, do they get the plasma from the patient, or is it from someone else, like a donor?
It's a simple procedure where we draw off a small tube of blood, just as if you went to a lab and had a blood test, and then we'll put it in a centrifuge and spin it down and collect a portion of the plasma that has a lot of platelets. In that same layer, there's a lot of growth factors and other substances that stimulate the body's healing response, and then inject that into the problem area in the body. It's got some promise.
Sounds interesting. Speeds up the body's own healing process.
That's the theory, at least.
All right. Good stuff. Thank you very much, Roland Mayer from the Center for Orthopedics. That'll do it for this edition of our Medical Minute. Halftime will continue. We'll come back. The high school game of the week. You're watching it on MyTV9 and WTNH.com.